Mechanism of intracellular action. Okay, that we say it. This was our mechanism on the level of organs, yes. But what happens inside the cell? What happens inside the cell? Beta receptor is the G-coupled protein which activates the membrane enzyme adenylate cyclase. Adenylate cyclase, which function is to convert ATP into the cyclic AMP, and it activates through the blocking of this enzyme. Okay, so in the end, we have the increased calcium and the increased contractility because CAMP is the secondary transmitter which activates the protein kinases, which stimulate the level of, increase the level of calcium inside the cell. So finally, in the cardiac myocyte, that which is I said about the blocker. No, split, yes. So beta receptors, when they are activated, all this happens, but when they are blocked, it goes opposite. Yes, G protein is not activated, adenylate cyclase is not activated, ATP is not converted into AMP, so we will have less AMP, and finally we will have no increase of calcium in the cell if we use beta blocker. So in the cardiac myocyte will be less calcium, and less calcium, it means for the heart less contractility. Contractility and less contraction and less heart rate, yes, less conduction and so on, less automaticity. The beta blockers are also divided into several generations. Yes, the first generation, which are non-selective, as I already said, they are blocking both beta 1 and beta 2 receptors. Beta 1 and beta 2 and beta 2 receptors. As you see, they are used, they can lead to bronchoconstriction. This is a constriction of bronchi. Why? Because this is the beta 2 receptor effect. Beta 2 receptors are stimulating and in case of stimulating beta 2 receptors, they relax bronchi. But if you block, they contract bronchi. Yes. Also, they are used in case of glaucoma. They reduce the intraocular liquid, intraocular liquid, and so also they are used in case of headache. What else? Beta blockers of the second generation, which are beta 1 selective. Only beta 1 they block, and they have directly effect on the blood pressure predominantly without many side effects. And the third generation, which are also having some special good effects. Carvedilol with labetalol, they block not only beta but also alpha receptors, which is very good also for the blood pressure because they relax the blood vessels, yes. And also we have the selective, again, beta receptors, but which also, for example, nebivolol can release the NO, the nitrous oxide, which also can relax, again, the blood vessels, again, relaxation of blood vessels, and the calcium channel blocker, betaxolol, calcium channel blocking, this means less calcium in the smooth muscle. Yes, we remember that, again, it helps to relax the blood vessels, and also used for the decrease of intraocular pressure in case of glaucoma. The sympathetic, also very interesting group of drugs, which are used for the effect on the presynaptic membrane only. They are octadine and trazerpine, and their mechanism of action, they deplete of endogenous norepinephrine, which inhibits the sympathetic system. So normally norepinephrine, as you see here on this picture, normally this norepinephrine is released from the presynaptic membrane and goes to the postsynaptic membrane, yes? But also what can happen? Also it can go back to be reused, yes, recycled, like recycled. it will be used again, and it can come back for this. So our drug, which is reserpine sympatholytic, blocks this process of the reuptake, the neuronal reuptake, and norepinephrine will not be recycled. If it is not recycled, so we have by some time we will spend all the like how to say, we will spend all our stores of the norepinephrine, and finally here will be nothing. So finally, it will just be all spent. This is the effect of sympatholytics. So finally, they work not quickly. They have long time for the upset of action, and they also have the prolonged effect. Prolonged effect. What does it mean? It means even when you stop drinking the tablets, if you stop taking the tablets, still sometime your blood pressure will not increase because still the effect will be prolonged. Okay, now we are coming to the renin-angiotensin-aldosterone system. I already said about it several times, and now let's check how it actually works. Yes. So firstly, in our blood, there is a circulation of angiotensin gen, which is not active. This is a pro enzyme, pro molecule. It is not active. And from our kidneys, we have the release of renin. Renin is released from juxtaglomerular apparatus of kidneys, in which case it will be released. In case if there is a low blood pressure for the kidneys to have enough filtration. So they want to make a higher blood pressure, that's why they release renin into the blood. Renin will convert angiotensinogen into angiotensin 1, which afterwards in the lungs and some other organs by the enzyme angiotensin converting enzyme would be converted into angiotensin 2, the most active substance of all. Don't forget that this is angiotensin converting enzyme, these letters. Angiotensin 2 can do what? It can affect on several types of receptors, AT1 receptor, AT2 receptor, and also it can affect on the adrenal gland, cortex of adrenal gland, and finally, what we can see through the effects. If we have the effect of angiotensin 2 on angiotensin 1, the first type receptor, they lead to so-called bad effects. Okay, they are not really bad, but for our patient who has high blood pressure, they can be unwanted. This is vasoconstriction, which increases blood pressure. This is sympathetic activation, which also increases blood pressure, and also fibrosis of the myocardium here can happen. Here, in the second type of angiotensin receptors, we have opposite effect, the vasodilation and antidiuretic hormone secretion. And if the angiotensin effects on the adrenal gland, it increases the release of aldosterone. Aldosterone is responsible for the reabsorption of sodium and water from kidneys. Yes, so they increase the circulating blood volume. Okay, this is the system. And how can we effect on this system? We have several groups, like we have the renin inhibitor, which is aliskiren. We have angiotensin converting enzyme inhibitors, which are prils. We have angiotensin receptors inhibitors, blockers, angiotensin receptor blockers, which are sartans, and aldosterone antagonist, which is spironolactone. We will further see these names, I guess. Mhm. Okay, so this is actually again the same scheme in which you can see that angiotensin will be converted by renin into angiotensin 1, then into angiotensin 2 by the help of ACE, which is produced in lungs, and then effects, yes, in adrenal cortex, aldosterone is secreted with angiotensin 2, which directly in pituitary gland secretes the antidiuretic hormone vasopressin. All they increase the blood volume in kidneys, and also we see by the effect on arterioles, we have vasoconstriction with the effect of angiotensin 2. Okay, the scheme just shows us the same. Here are also some effects of angiotensin 2 because we see that it can give really many different effects, and for us the most important is we have the hypertrophy of the heart, which is very bad for us, yes, and some effects like inflammation and less protective factors like NO. So angiotensin 2 is a very important molecule, but it has many bad effects for our health. So now, as I said, we have some names of the drugs. The angiotensin converting enzyme inhibitors. 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 Inhibitors which are endings with pril, да, captopril, enalapril, mechanism of action they block this enzyme and transition of angiotensin 1 to angiotensin 2. The angiotensin receptor blockers, which are sartan, losartan, and irbesartan, and the mechanism of action is to block just receptors directly in the vessels, and it happens to relax, leads to their expansion. And aldosterone receptor blocker, this is spironolactone, actually blocks the receptor directly in kidneys, but we can see that it leads to attenuation of sodium and water reabsorption, so will be reduced BCC decrease in this is blood circulation, volume of the blood circulating blood in the body, so will decrease the blood pressure. Okay, level of calcium. And level of calcium we go in the second part of our topic.